Hi folks, I'm Dr. Ed Beyer. Today we're going to be talking about something known as leaky gut syndrome or increased intestinal permeability. Folks, this is something that sometimes when I mention it to some of my colleagues or other doctors or people or patients, they look at me like I don't know, like I got a third eye on my forehead. But the concept of having an increased gut permeability has been around for about 100 years. The major barrier between our outside world and the inside of our body is not our skin, it's the lining of our small intestine. And there's a one-cell layer lining our small intestine. And this layer is, these cells are held together by very important proteins called occludin and zonulin. And these proteins can pull apart. And then you have a hole in that layer, or the permeability is increased, and that can cause all kinds of bad things in the body. Larger than normal molecules of food, toxins, and various things will make their way into the bloodstream that don't belong, setting off a cascade of problems that we see in almost all chronic diseases. Now, the concept that I want to make today in my video is when the gut is on fire, the brain is on fire. When this barrier system breaks down, eventually and sometimes quickly, the barrier between our blood and our brain breaks down, and that causes neurological problems. Here's the bottom line. When people come to me with digestive problems, almost all of them have different neurological problems that they don't think are related. Depression, anxiety, brain fog, memory loss, attention deficit problems, all kinds of movement disorders, tics, headaches, hormone imbalances, high blood pressure, and so on. So fire in the gut equals fire in the brain. This is all in the scientific literature. In fact, here's a study right here that shows that almost 50% of people with inflammatory bowel disease, which is ulcerative colitis, Crohn's disease, and celiac disease, 50% of these people, this study shows, have white matter plaques in their brain. In other words, the inflammation in the brain is so bad that they're developing these plaque formation, which is not good for the brain. And this was in 1996, so it's been around for a while. Inflammation. Now, what I want to talk about today is what will cause the gut barrier to break down, and that's inflammation. Anything that'll cause inflammation in the gut will cause the gut barrier to break down, and it'll cause a breakdown of these occludin and zonulin proteins that hold the cells together. And when those proteins break down, our immune system forms antibodies to them. Now we have the same barrier system between our blood and our brain, and those antibodies against the occludin and zonulin in the gut will attack the occludin and zonulin in the brain, and so we get leaky blood-brain barrier at the same time. Leaky brain barrier now leads to all kinds of brain inflammation, which can lead to symptoms like depression, anxiety, brain fog, memory loss. I mean, folks, Alzheimer's, 1 out of 3 adults after the age of 65 will develop Alzheimer's. If you've experienced someone in your family that has it, you don't want that. Loss of autonomic function, things like hypertension and diabetes can be related to poor autonomic or brain function in the body, and obviously digestive function and poor circulation and neurodegenerative diseases, Alzheimer's, Parkinsonian type syndromes, supranuclear palsies, cortical basilar atrophy, and multiple systems atrophy. These are all different neurodegenerative diseases, and this is one of the reasons. Leaky gut leads to leaky brain. I'm Dr. Ed Beyer. Hope that helps. Have a great day.